Hello, my name is Dr. Patricia Montealegre. I'm the International Director at SJD Barcelona Children's Hospital. And the main objective, the main goal of my department is to be able to spread SJD knowledge around the world. I didn't think about doing anything else but being a doctor. I was trained as a quality manager in a health institution. From quality management, I trained myself in healthcare management because I really thought that I was going to be able to take care with the highest levels of quality of the services that were provided at any health institution. We treat around an average of 1,200 patients every year, and they come from 141 different countries. But mainly, we receive patients coming from the Middle East, Europe, and Latin America. We are approximately 50 persons in the department, and we have two areas, the development area and the operational area. The development area is the one that is in charge of looking for new patients to come to our hospital, but also to open our knowledge to train doctors all around the world. And the operational area is the one that takes charge of all the requests coming to our hospital. We receive around 4,500 every year. So this is a quite huge amount of requests coming, and this requires a lot of specialized pathways inside the hospital in order to have a very quick answer to these families that are requesting for treatments. We come mainly for very highly specialized treatments. Those are specifically oncology and rare diseases also, and especially those with multidisciplinary approach that may need a lot of subspecialties working together at the same time. We are a highly specialized hospital and an international reference hospital in pediatrics. In Europe, we have been accredited for all the high specialized reference networks.
At an international level, our research has a very relevant impact since our publications are cited 2.7 times the world average.
We offer multidisciplinary approach and also an holistic approach of this family and the patient, so that we can support them in all they may need, not only medically, but also socially speaking. If they need support with translations, with psychology, rehabilitation, and accommodation. We talk between 10 and 12 languages with our own team, and we use other companies, translators, to come if the language that is required is not a very common one. Apart from that, so that communication is very fluent between the teams and the families, we also try to adapt to their schedule, to their timetables, to their habits, to their religion. So we have areas for prayers for different cultures. We also have and celebrate different events coming from different countries, so that we adapt. Apart from celebrating, we can also adapt the meals for the patients that are admitted, so that if they have special requirements, we are able to offer them what they may need. And we are obtaining a very high level of satisfaction in all the families, in all the parts of the funnel of their treatments in Barcelona. I think the secret is getting closer to them, listening to them, and trying to adapt. Well, my background as a doctor allows me to understand a lot of procedures, allows me to organize different services, but also to be able to talk about my hospital when I go out and talk about SJD. If I weren't a doctor, I would not be able to understand what my teams are doing, what my teams are researching, what my teams are going through at any point in our hospital. So I think it's the main point to be a doctor.